Hello, we're answering questions on health and medical problems. I'm joined by Dr. Rosemary Leonard. Hello.
Hello.
Rosemary, we've got a question here from a man concerned about his water intake. He's written in to say, recently I've developed an insatiable thirst for water. I feel as if it's a need to drink all the time, which has meant that I need to urinate far more than normal. What does this mean, he says?
Well, the classic that this could be is diabetes, where you are losing glucose in your urine, which in turn makes you thirsty, therefore you drink. And the first thing he needs to do, and he needs to do it as soon as he can, is go along to his practice nurse or his GP and get a blood sugar test done. Because if you have got diabetes, the sooner it is diagnosed and the sooner those blood sugar levels are brought under control, the better it is, not only for his symptoms now, but for his general health in the future. And we know that in the UK, there are at least 1 million people out there who've got undiagnosed diabetes. And diabetes can cause long-term health problems, so it is very important that he goes and gets this checked.
Gets it sorted as soon as possible. It can be other things, though, drinking lots of water, can't it?
Yes, I mean, we quite often see people who are needing to drink water because they have a dry mouth. Now, it's more common in women. There is a syndrome, a dry mouth syndrome, where you don't produce enough saliva and therefore you have to keep drinking water. The other thing it can be is a common side effect of medications, particularly in elderly people. Quite a lot of medications we use for heart conditions can give you a dry mouth, which then you need to keep drinking water. So this is something that can usually be sorted out.
And if you were taking medication, would it say it on the side of the box? Would it say one of the side effects might be?
Yes, it can be. There's a package insert inside the box of medicines. I mean, one of the problems is these package inserts, so the print on them can be very small.
Very small, and it says an awful lot.
It says an awful lot. It can be very worrying. So, but the thing too, if you don't want to go and bother your doctor, is just have a word with your local pharmacist. They'll be able to tell you the medications you're on, whether dry mouth is likely to be a side effect.
Fantastic. Thank you. Good advice, Rosemary. Well, if you have a similar problem, we hope we may have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thank you for watching. We'll be back with more health questions and answers.